most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about the herniated disc. We're going to clearly explain it, and we're going to show how to easily fix it, too.
That's right, Bob. This video, I'm excited to. We got some really good information, put you at ease.
You'll understand how it works. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And you're going to want to go to bobandbrad.com because right now we're giving away, we're always doing a giveaway.
That's right.
Go to the giveaway section. We're giving away a Sleepovation mattress. We'll talk about this in just a minute. You can also go to Facebook. It'll be pinned to the top of the page. Twitter, Instagram, or TikTok if you want a 60-second version of our program. Our giveaway, Brad, this is just a sample of it. It obviously comes in all the sizes that you need. You can't even see these when you get the mattress. It's got the cover over it.
Right, then this is the cover cut away.
Yep, and you got 700 individual mattresses.
700 tiny mattresses.
Yeah, and it's got air channels. And what this does is really provides you with a lot of pain relief.
Right.
I think it's the best pain relieving mattress out there.
It's the best I've used. I love it. I sleep all night.
I'll get rid of this.
Yeah, carry on. We got work to do with the herniated disc, Bob.
All right.
Okay, so we want to talk about herniated disc. If you got one, you've been an MRI or however it may come to you, you're pretty nervous about it.
Right.
You're thinking, a lot of people right away, they think about surgery, but you need to know all the facts about it first, and that's what we're going to show you. There's a lot of good news out there, Bob. And first of all, let's talk about a herniated disc. First,
where does it happen most commonly, Brad?
Good point. And the research shows 95% happen between L4 and L5, L5 and S1.
And we'll show that on here.
Which is right about the belt line.
Yeah, and it makes sense because that's where the stress first comes when you bend forward.
Right.
Yeah.
I mean, it makes sense to therapists.
Yeah, it makes sense to
but you have
therapists.
to trust us. So if we look at the spine, the belt line would be right about here. And so we're looking, actually, this red disc represents a herniated or a bulging disc between L4 and L5. And then the next disc down would be the next one that is very common. So we're looking at this. Can you zoom in on this, Mike? Okay, you can see the red disc and the bulge. And this nerve right here, L4, L5 nerve, is getting pinched. And that's going to send signal or pain, numbness, tingling, all these weird,
burning,
uncomfortable symptoms down the leg all the way to the foot.
It can.
Yes, it can. Not always, but it's not uncommon, that's for sure. So what we need to do is get rid of that bulge one way or another. Surgery can be an option, but hold on. There's a lot of other things that can happen before that.
And I want to show one thing, Brad.
Sure.
You know, the thing that causes it to bulge or herniate is if you bend the back forward like this. Can you see how that? We'll show in a minute why that works out. But as I start bending here, the bending first occurs here, then there, then there. You know, so that's why the bending almost always occurs at the low back,
especially with poor body mechanics, which happens to be very common, as well as poor posture with sitting. When you slump.
Especially you slump all the way.
That puts a lot of pressure on that herniation to actually get worse. So that's a key part of this is straightening up your posture. Use lumbar support in your chair so you maintain
Don't be lifting like this.
Yes.
Be lifting like
this.
Yeah.
If you got a herniated disc, you're just going to stop lifting. You really got to use it. You know,
you won't even be able to do it because it hurts.
Yeah, take a break from that, and you'll find someone else.
Should we show the cup spread?
Now, if we look at the herniation, now this will make it a little more clear. We can throw that. That one retired. We're going to use a red ball because it matches the red disc.
Oh, there we go.
Yep. So this is L5. Remember, L5, L4, L5 herniate the most, or 95%.
There's the disc. The red ball represents the disc.
Yep. Now, this is the back side of the disc. So the spinal cord goes through here, and your spinal nerve that gets pinched comes right out here. So a healthy disc has some fluidity and it has give like this. So when you walk, it bounces. It's like a shock absorber. When you bend forward, things flex. When you bend backwards and rotate, the disc must be flexible, must be pliable for a healthy back. But what happens is when you sit with poor posture, you bend with poor body mechanics year after year, the disc can start to bulge. And look at that. You got this bulge, just as exaggerated. It's not exactly, but it gives you the concept. We need to get this bulge now pinching the nerve. We've got to give it some room in an exercise to allow it to go back in, eliminating the problem.
So the repetitive flexing, the repetitive bending wears out the back of the disc,
Yep.
is what you have. And you can actually get it to herniate too, where the inner substance of it, the fluid, actually comes out of the disc.
Yeah, and that's what we want to avoid. So, but there's good news about that. So you need to understand that, understand posture, particularly seated posture, and body mechanics of bending is a critical aspect.
Do you want to talk about statistics now,
Oh,
Brad?
absolutely, Bob. This is important. So 19 to 27%, that's like a fourth of people with herniated discs have no symptoms.
Right.
And they don't even know it, and they live like that, and
So
it's okay.
both Brad and I, most likely, it's possible we have a bulging disc, and certainly we might have a herniated disc, and we don't even know it because we're not having any pain, and that's very common.
And that's okay. The body is
the
adjusted
studies,
to it.
right.
It's not pushing into the nerve, and it's okay. And they've done that because they've taken MRI studies of healthy people to find this specific information out.
It's funny. I just had a neighbor who went in for a scan. I said, they're going to find it. They're going to find something because it's part of aging.
Yep.
The older you get, the more likely you're going to have a herniated disc.
Which brings us to the next point.
Sure.
The people that mostly have herniated discs are between the ages of 30 and 50. Once you get closer to 60 and older, the disc, the annulus,
it doesn't have enough fluid.
Yeah, it starts to gel out.
Nucleus pulposus is
Yep.
the center.
The fluid in the middle that becomes more like crab meat. That's what an instructor told me in one of my back courses. So older people don't have herniated discs near as often as between 30.
Symptomatic herniated disc.
Yeah, between 30 and 50. So that's a little tidbit to remember. Now, if you're male versus a female, there's 2 males that have a herniated disc versus every female. So you're twice as likely if you're a male. Now, this next one is really important because 90% of patients diagnosed with a herniated disc that's been treated after 6 weeks, 90% of them are not candidates for surgery. Why? Because they've gotten better and they resolved the disc and went back in, and life is good again.
So you have very good odds of not having to need surgery if you follow a program.
Right. And some people just get better without seeing a therapist at all because they avoid things that hurt them naturally. But if you get information like we just talked about with the bending posture, and we got some exercises. Now, Bob, should we tell them about?
Sure. Actually, if you want a complete program on this, you go to bobandbrad.com, go to the program section. This is completely free. We don't even ask for an email.
Right.
It's just we have 50 some videos on sciatica.
It's a lot. Don't get excited about that. You don't have to. You only watch the ones that pertain to you.
Right. So
there might be 3 or 4 only.
Yeah. If you're having trouble with sitting in a car, we have a video on that. We have the whole exercise program, the complete exercise program you need to do in that series.
Right.
So,
and the great part about it is and they're usually about 10 minutes long. They come with a PDF printout, so you can print out the exercises, so you don't have to go back and look at our faces anymore.
That's right.
You can say, "What exercise did he say?"
You actually could print it out and not even watch the videos.
Oh, Bob, you cannot do that.
Yeah, these are really instructive, demonstrative. That you need to be
I mean, you could,
demonstrative. There we go.
Anyways, it's really good service that
Should
we're
we give them
offering.
a sample of some of the stuff you do in there, Brad?
Good idea, Bob. Let's do it. Some of the more common exercises.
One of the staples of this, and it's from Robin McKenzie developed this, really quite groundbreaking when it came out, to be honest with you, is you start by lying on your stomach, and then you get up onto your elbows. Can you see how I'm actually bending the back the opposite direction now?
Yeah.
And this is what to help try to push that disc in. Now, sometimes even just lying here, Brad, can help gravity.
Yep.
Push that in. But eventually you move to put your hands beneath your shoulders, do some micro press-ups, mini press-ups like this. And I'm trying to push that disc in even further. And I was always taught by my McKenzie instructor that the magic happens when you start getting up really high.
Yep.
And what you don't want to do is you don't want the pelvis to come off
Sure.
the bed.
Sure.
That means you're not doing anything anyway. Then it's just staying straight.
Yeah.
So you got to work on getting the bend here.
Should we show them one of the little tricks? If that doesn't work, we can show them what we call the banana.
Sure.
So with the banana, if we could get the camera to look straight down, that's where you see the banana shape.
I'll say the pain is down the left leg.
Yep, closest to the camera.
So I'm trying to close this side down.
Yep.
So what I'm going to do is I'm going to put these legs out here, and I'm going to bring these shoulders over that direction too. So in that fact, I've created a banana shape.
If you're looking from the top down.
Yeah. And now once I'm in that banana shape, you can try to do a few press ups here. These are not as easy to do once you're in that shape.
You're only going to do this if it works. If it makes the leg feel better, you continue. If not, you might go to the next one.
The next one is the roadkill, where you actually take on the same side again,
Yep.
the painful side. You take your foot and put it on your knee of the opposite leg.
Right here.
And again, sometimes just getting in this position feels good.
I've had a number of patients say, "Oh, my leg feels a little better already." And then I know we're on target.
Yep. And what we're looking for is that your symptoms going down the leg are improving. We're not looking for improving the back pain right away. We're looking for the symptoms. Generally, further down, the more we expect the symptoms to get better. So like all the way down to the foot, we like to see the numbness or tingling or the pain get better.
In other words, yep, moving up.
Moving up, yep. So again, I can do some press ups in this position, but again, we explain it with better clarity in the program because we take more time and
Right.
we're more demonstrative.
Wow, Bob,
my favorite word of the day.
Yeah, you've been looking things up. But yeah, the programs, it's just such an easy way to have a whole plethora of videos at your disposal very simply.
We want to mention too that walking's a good idea always with sciatica.
Mhm.
Try to do some walking with maybe short strides and work on it. We're running out of time, Brad.
Oh, yeah.
Let's say goodbye to everybody.
Take care and good luck.